as always, I'm trying to bring very important topics to the forefront of women's health and to give you very high-level descriptions of these disease processes or these conditions or problems that may impact your health in a negative manner, and then kind of guide you down a pathway of letting you know where you can start for evaluation purposes. So polycystic ovarian syndrome is one of those topics, and while there's very high-level information that will be discussed today, other videos will delve into more detailed topics and discussions about different topics impacting polycystic ovarian syndrome patients. But the most important aspect of polycystic ovarian syndrome, or at least signs and symptoms that can be more significant for PCOS, would be missing extended periods of menstrual cycles, or even missing a menstrual cycle or several menstrual cycles. Some polycystic ovarian patients will miss up to 12 months of menstrual cycles. Some patients skip every other month of menstrual cycles. Some patients have a menstrual cycle every 3 months. It's very different depending on the patient and the clinical circumstance. But most important in this arena of discussion is to be sure that if you're having irregular menstrual cycles or you're missing menstrual cycles, that you talk with an OBGYN clinician. The evaluation for polycystic ovarian syndrome is quite quick. It's easily diagnosed, and it can prevent very significant morbidity and possibly even mortality should a polycystic ovarian patient develop undiagnosed uterine cancer. So it's very important that even in young, healthy women that you get this evaluation completed, because precancer and cancer of the endometrial lining can happen with polycystic ovarian syndrome. So it's very important. And again, the evaluation usually is completed by OBGYN physicians. It usually involves a pelvic examination with pap smear, a simple pelvic ultrasound, and then laboratory evaluation. So it's not super invasive, and there's not a lot of pain involved with the whole process of evaluation, but it's vitally important. As well, it can prevent a lot of comorbidity and issues with your health, inclusive of issues such as precancer and cancer of the uterus, issues that may involve infertility, issues with metabolic syndromes, different types of issues that can put you at risk for diabetes. So these are very important topics. So please be sure that if you're skipping your menstrual cycles or missing your menstrual cycles, that you consult with an OBGYN physician. And again, in future videos, we'll go into more detail, but at the highest level, if you're missing your menstrual cycles, please talk with an OBGYN. Stay healthy. Take care.